Today we have Dr. Deanna Mosley-Lawrence for our Q&A with the Veterinarian. Dr. Lawrence attended NC State University and pursued her bachelor's in animal science, followed by her doctorate in veterinary medicine. In 2009, she opened Hope Animal Hospital, and soon after she created Hope's Chest, Inc. And do you want to say a little about what they do?
We are a nonprofit that we kind of have a special niche in the world of nonprofits in that we actually are a medical fund for hurt and injured animals that come into our local animal control. And so what we do is we provide medical care for animals that don't have anybody to actually provide that care for them.
Today's video is on Feline Immunodeficiency virus, or FIV. So what is FIV?
So FIV is actually a virus that in essence causes AIDS in cats. So we all know what HIV is. It's in essence the feline version of what we have on the human side as HIV. The most important thing to realize is that FIV is not transmitted to people. So I have a lot of people that will come in and we find out that their cat is positive for FIV, and the first thing they think of is, oh my gosh, am I going to get something? No. But in essence, what it is, it's truly the same type of scenario where it causes the AIDS in cats.
So how is it transmitted? Are there any ways to prevent it?
So it's transmitted actually through bite wounds, and it has to be direct contact with blood. That's one, and I hate to say it's a nice thing about it, but it's not as easily transmitted between cats. The virus can live out in the environment for a few hours, but it can still be taken care of with disinfectants. So even though there is a higher risk of cats transmitting it back and forth, if you properly disinfect, you actually help prevent the spread of it. But the biggest thing is to realize that if a cat bites or is a biter, then it's going to be higher risk for transmitting it if it's positive.
So are there any symptoms if my cat gets FIV? What are the symptoms for?
So the symptoms typically are, and this is what the hard thing is with any type of disease, is that there's always the same thing that kind of goes back and forth. So feline leukemia and FIV are so close sometimes in appearance that a lot of the symptoms actually match between the two diseases.
Wow.
So in FIV, the things we see a little bit more specifically are in an enlarged lymph node. So if their lymph nodes in their throat or in their armpit areas or in their inguinal areas are enlarged, that makes me suspicious. They have a persistent fever. So if I have a cat that just keeps coming in and the only sign is that it just keeps having a fever and we never seem to get rid of it with antibiotics or different things and it's just staying around, that could also be an indicator that it's FIV. If they're just chronically having infections or illnesses, if they just are unkept, they stop taking care of themselves, they just start deteriorating in general, just symptoms like that, those are things that we look for. They're just not healthy creatures. And the simplest thing for us is, again, we have a test. So if I have any cat that comes in that's showing any of these signs and I don't know, is it leukemia or FIV, the test actually is a dual test, so it tests for both diseases in the same test. I do get some cats that actually have both.
Oh wow.
Yeah, and that's unfortunately that's not a good thing to see both of the viruses in a cat. A lot of times I wonder which came first. Did it allow the other one to then show itself, or at least be part of the whole combination of all the symptoms that are happening? But it is, again, we can test, and so I know pretty quickly if a cat comes in with a lot of these types of symptoms, I'll know what it is.
So if my cat's exposed, what do I need to do? What's the first thing I should do?
So if you have a cat and you know it's been exposed to an FIV cat, and it has been tested at some point and received, it's been going to the vet and that type of thing, unfortunately there's not a vaccine. That there is, this is where it gets a little complicated. So there's no cure for FIV. So if your cat gets it, there's not a cure for it. But the vaccination that is for FIV, I don't know, I can't say it's not a good vaccine. It's a good vaccine, but the problem with it is that it makes your cat then show itself as being FIV positive. This is where it gets kind of crazy, because if I'm testing a cat and I get the test result as being FIV positive, I really don't know, does it have the virus or could it possibly have been vaccinated? As a veterinarian, I don't vaccinate for FIV because the vaccine itself, yes, there's some improvement, or at least some help with fighting the infection if they're exposed, but it's not the greatest help. So to run the risk of vaccinating and not really getting much benefit out of the vaccine, and then on top of that, now that cat is going to show as an FIV positive cat with any test run on it, I choose not to actually vaccinate for it, because it's just not a good enough vaccine to warrant the use of it, if that makes sense.
Yeah.
Because the thing is that FIV has to be spread by blood contact between two cats. So if your cat, let's say, got bit by a stray cat, if I were to test it that day, it would be negative. It can actually take 60 days to 90 days for that animal to actually turn into a FIV positive cat. So it's going to be a long, couple months to have to sit there and wait. So what we usually do is we'll test every 60 days up until 6 months after they've been exposed, because at some point in time that virus can start showing itself. That's the hard part, because I could test the cat a month later and it be false negative, because the cat's going to turn positive in a couple months. It's just not showing itself yet, and vice versa. Sometimes I'll actually get a positive. So then if I get a positive, do they receive a vaccine at some point in time? That's a possibility. There could have been another veterinarian that had vaccinated for that virus. The other thing is that the mother, so if I have a kitten that tests positive, the mother's maternal antibodies could be still in the kitten, to where it, up until 6 months of age, could show as an FIV positive cat. And it's not really. So if I have a kitten, if an owner brings me a kitten and it's testing positive for FIV, that doesn't tell me anything. At that point, I have to wait until they're over 6 months of age to know 100% that that cat is negative or positive. If it's 6 months old, he's still positive or she's still positive, then I know the kitten has FIV. FIV is a complicated one. It's a little bit harder, because sometimes just being FIV positive, it's not a death sentence. There are some kittens and cats that can live a normal life for their entire life and die of other diseases and never show the disease. But if it starts showing itself, then it's usually not it's not going to be a good prognosis for them.
So, you said there wasn't a treatment for your cat if it does end up being FIV positive. So is there any way to care for it and make it more comfortable?
So again, supportive care. So a lot of things, if it's a disease that's affecting them, sometimes, especially with a virus, the only treatment is supportive care. So if they have a persistent fever, we may need to use medications or do fluid therapy or different things to try to help bring the fever down and make them more comfortable. Sometimes they will get through a battle and start feeling better, and then a few months later they'll start showing symptoms again, or it could change to a whole different scenario. The other thing is that a lot of times FIV positive cats, because their immune system's weaker, they are more prone to cancers. So the number one cancer they're prone to get is lymphoma. You can actually use chemotherapy drugs in an FIV positive cat that has lymphoma, and it may actually help decrease the symptoms and help with making the cat more comfortable. But again, eventually it's going to take back over again. So you can do some things to help make them comfortable, but there's not a cure.
And that's the video on FIV.